Mayroon ng reported cases ng monkeypox across Europe, the Americas, Middle East, Asia, and the Pacific. Ayon sa World Health Organization, 2,103 confirmed cases na ng sakit ang nadetect sa mundo. Virus na naman? Mahigit 2 taon na nating dinaranas ang COVID-19 pandemic, kaya nakakatakot ang bagong threat ng anumang virus. But what is monkeypox? And more importantly, bakit dumadalas ang virus outbreaks sa mundo? Here's what you need to know. First of all, ano nga ba ang monkeypox? And although we are perhaps entitled to panic after the recent pandemic traumas, should we be worried?
We should not panic, we should not be worried because I think this is more manageable, more controllable compared to that of COVID-19. Monkeypox is an infection caused by a virus that is under the family orthopox virus. So this family also included chickenpox and measles. It also includes the smallpox.
Ang mga sintomas nito ay kagaya rin ng sa smallpox, pero hindi kasing lala. Kasama riyan ang lagnat, sakit ng ulo, pananakit ng katawan, exhaustion, at rashes. 7 to 14 days ang incubation ng virus, pero maaaring tumagal ng 5 to 21 days.
It can affect the brain. We call that encephalitis. It can also cause respiratory tract infection and can have both a viral pneumonia and a bacterial pneumonia. But there's a possibility that this complication can cause death, especially to the vulnerable population.
Isang uri ng zoonotic infection ang monkeypox.
So ito yung parang condition wherein a virus has the ability or has already jumped to another set of hosts. So from animals to humans. So dito ang nangyayari. A lot of the outbreaks have been described as zoonotic. WHO actually has listed priority diseases that have the potential to become epidemic or pandemic. All of these are zoonotic as well.
The monkeypox reservoir remains unknown, but scientists suspect that the primary hosts are rodents. So, paano ito nakakahawa? Pwede itong makuha sa galos, kagat, o pagkain ng kontaminadong karne ng hayop na apektado ng virus.
It's highly contagious because it is transmitted through respiratory droplets. So meaning by coughing, by talking within 3 feet, or even touching the patient's skin lesions if you have break in the skin, or if you have sexual contact with that particular person who is having the infection.
Monkeypox is usually rare. What's unusual ay ang pagsulpot nito sa iba't ibang panig ng mundo at once. Hindi pa malinaw kung paano nakuha ang virus ng mga pasyente, but the spread suggests community or person-to-person transmission. Sa UK, nakumpirma ang unang case ng monkeypox noong May 6, 2022. Sa mga sumunod na linggo, dumami ang reported cases ng disease across Europe, including countries like Spain and Portugal. Belgium became the first country to introduce compulsory quarantine, while France, Italy, and Germany confirmed cases around mid-May. Sinundan nito ng mga kaso sa Netherlands, Austria, Israel, and Switzerland. Kasabay ng pagkalat nito sa Europe ay ang mga outbreaks din sa Canada, United States, at Australia. Wala pang confirmed cases ng monkeypox sa Asia, pero na-detect ito sa Thailand sa isang air transit passenger mula Europe patungong Australia kung saan ito nag-develop ng symptoms. Nito lamang June 1, isa pang pasahero na galing rin Europe ang nag-transit naman through Singapore papuntang Australia ang nagpositibo sa monkeypox. There are currently no reported deaths in the US or Europe at wala pa ring naiitala o pinaghihinala ang kaso sa Pilipinas. WHO described the risk to public health as moderate dahil sa bagong pattern ng transmission at madaling pagkalat nito. But the organization will also convene an emergency committee on June 23 to determine kung dapat bang i-consider na global health emergency ang kasalukuyang outbreak. Ito ay dahil sa unusual behavior at geographic spread nito na kailangan ng coordinated response.
Hindi pa ganun kalaki ang mga affected, no? So, there's a possibility na magiging epidemic proportion siya, but I don't think yung epidemic proportion niya as wide as COVID-19.
Nananatili namang 3 to 6% ang case fatality ratio, habang ang recovery rate,
Most of the time, ang recovery rate nito is talagang mataas, no? So more than 80% ang recovery rate nito. So at least ang 20% na yan, yun yung may mga komplikasyon. Ang monkeypox sa kasalukuyan ay walang gamot, no? So ang pagtrato nito in terms of treatment is mainly supportive. So halimbawa may lagnat, bibigyan ka ng paracetamol. Kailangan lang linisan lang yung rashes na hindi magka-superimpose sa bacterial infection. So, kailangan ka lang ma-isolate sa isang hospital or sa isang room para hindi ka na rin makahawa at i-monitor doon sa mga komplikasyon.
how about vaccines?
So, sa ngayon, sa bakuna, ang bakuna na ginagamit natin sa smallpox, that can also protect us against monkeypox. No? And in fact, yun ang ginagamit ngayon sa ibang bansa na kung saan endemic ang monkeypox, no? Kagaya sa Western and Central Africa.
According to Centers for Disease Control and Prevention, smallpox vaccinations are 85% effective in preventing monkeypox. This is the first time na nagkaroon ng monkeypox outbreak sa iba't ibang bahagi ng mundo. Pero hindi ito bago at matagal na ring pinag-aaralan ng mga eksperto. It was discovered in research monkeys in 1958, hence the name. Pero iminumungkahi na itong palitan to be non-discriminatory and non-stigmatizing. The first documentation of the virus in humans was not until 1970. Karaniwan itong makikita sa rural and rainforest region ng West and Central Africa. Karamihan ay sa Congo na may halos 6,000 cases kada taon at Nigeria na nasa 3,000 ang yearly cases. The most recent outbreak outside Africa was in the US in 2003. In the last 10 years or so, tuloy-tuloy rin ang pagtaas ng kaso ng monkeypox. Bakit nga ba tila sunod-sunod ang disease outbreaks sa mundo? And should we expect even more?
When we're still reiterating that it's not a matter of if, but it's a matter of when. So, kung titingnan mo, although SARS-CoV, the first SARS-CoV appeared 2002, 2004, MERS-CoV 2012, and then SARS-CoV-2 is 2020 or latter part of 2019. So more or less parang every 10 years. And I wouldn't be surprised if it's going to be much shorter when then ito naman, may lumabas na uli na monkeypox. For the next 4 or 5 years siguro, baka magkaroon uli. It's sad to say. Well, for me, it's an inevitability.
The possible reasons sa pagdami ng outbreaks could be the narrowing spaces between human and animal habitats at climate change.
And we're seeing that now, actually, in different parts of the world. That the human and animal interface are definitely narrowing in different parts of the world where nagkakaroon na talaga in contact with them. So, and that would be a prime example, classic textbook case of a zoonotic spread of viruses. So this would probably give rise to different strains of viruses or different strains of pathogens. It's more something to do with the behavior of humans responding to drought, responding to prolonged rains, matindi yung kanilang paglilipat o migration. Higher temperatures would sometimes also equate to shrinking of the forest fires and stuff like that. And this would mean na nagkakaroon ng substantial decrease in the suitable habitat for these wild animals.
Isang halimbawa ng phenomenon na ito ay naobserbahan mismo sa Pilipinas noong 2014 sa Sultan Kudarat, kung saan 17 tao ang nagkasakit ng Nipah virus at 10 sa kanila ay nasawi.
There was an outbreak of Nipah virus very lethal virus, and the fatality rate is between 40% to 75%. So suspect that they got the disease from flying foxes. Actually, ang nangyari dito is the horses. So may namatay na horse, kinatay nila, and then just so happened na yung pinagtalian daw ata nila ng mga kabayo ay malapit dun sa puno na pinagpupugaran ng mga paniki na ito. It's been proven actually in other parts of Southeast Asia na flying foxes were the reservoir of this Nito virus. So the fact that these flying foxes were roosting near human habitations is actually a response to the shrinking habitat.
The effects of temperature changes have also been observable with malaria.
For malaria, kasi they're distributed usually in the equator, but with the warming of the temperature, so medyo nag-shift na yung mga areas sa buong mundo na nagiging mainit. So tumataas na. So now, these mosquitoes, which are vectors of malaria, so pumupunta na sila dun sa mga areas na medyo hindi talagang mainit, but in doing so, they're now coming into contact with a new set of naive hosts. At yung mga hindi pa nakaka-encounter ng mga, let's say, ng malaria.
Sa listahan ng WHO ng mga sakit na kanilang tinututukan, kasama rin dito ang tinatawag na Disease X. Ayon sa kanilang website, it represents the knowledge that a serious international epidemic could be caused by a pathogen currently unknown to cause human disease. Ang tanong, handa ba tayo for future outbreaks?
We have been laying out what are the mga steps na gagawin in the advent of magkaroon ng outbreak o magkaroon ng patient zero in any parts of the world in order to prevent another COVID-19 pandemic that we have experienced for the past 2 years. Of course, we cannot predict with precision kailan ba lalabas ang mga epidemic or pandemya. But what we would like to do or would like to envision ourselves to do is to at least be there or to have people to study the origins of these emerging pathogens as early as possible.